Nonverbal communication. When the verbal and nonverbal messages do not agree, the receiver is more likely to believe the nonverbal message. So, how to better communicate using nonverbal communication? Nonverbal communication is a form of communication that depends on body language, facial expressions, tone of voice, gestures, and dress. Nonverbal communication is an essential aspect in interpersonal relationships between families, friends, work relations, and its impact can be influenced by culture and gender. So, about 93% of communication is nonverbal. And as mentioned in the previous slide, the receiver is more bound to believe the nonverbal cues than the verbal cues. So, it is essential that an individual is able to pick up and learn some good nonverbal cues to learn or to utilize in their everyday life and in their work life.
Okay, so I will be talking about the families and nonverbal communication. So nonverbal communication is equally as important as verbal communication in families. It plays a huge role in the child-parent relationship, and it also is important to study the different type of parenting styles um, because each one of these expresses different emotions and attitudes by bodily communication, which is the authoritative, authoritarian, and permissive. And I will talk about those on the next slide. But each of these play a major role in the dyadic parent-child interaction. So to begin with, I will talk about each one of these. There was only 3 that they talked about, but there is a 4th one. So to begin with is the authoritarian. So the authoritarian I think about is the most strict parenting style. They are usually unresponsive, they have strict rules, high expectations, and expect blind obedience. So they attempt to shape, control, and evaluate the behavior and attitudes of the child. They also value obedience as a virtue and favors punitive, forceful measures when the child's actions would lead to conflict with the parents. Parents also believe in respect for authority and for the preservation of order and traditional structure. So for their nonverbal gestures and facial expressions, they are usually warnings or threats. So if a child is not doing something that they ask them to do, this parent might yell at the child or also do something else along those measures. And in terms of proxemics, which is the amount of space that people feel is necessary to set between themselves and others, this parenting style displays negative contacts, active protest, and invasion of the child's space. With the authoritative parenting style, I think about they are in the middle of everything. They kind of have those strict rules, but they are also there to encourage and guide the child and also kind of be their friend whenever they do need one. So they are nurturing, responsive, and supportive, but they also set limits for their children. So these parents encourage verbal give and take and sharing the child's reasoning behind the parent's policy. They recognize the child's individual interest and are always engaged with them. They want to learn more about like their interest and how that all goes. They also give the child freedom and guidance. And usually parental involvement is used to encourage the children to manifest their full potentials. They want their child to do well. So their nonverbal gestures and facial expressions are usually guidance and instruction, as well as encouragement and praise. And in terms of proxemics, they will use nonverbal body gestures or postures such as opening up or moving around. They also tend to move closer to the child and display positive contact with them. And then the last one is permissive. I think of this one as more of a friend than a parent because they don't offer so much guidance for the child, and they're also not very strict. Like they're pretty lenient on everything that the child does. So this one, they are warm but lax. They have few or no rules, and they are indulgent and lenient. So the parent attempts to behave in accepting affirmative manners toward the child's impulses, desires, and actions. They place very few demands. They do not represent an active agent responsible for shaping or altering ongoing or future behavior. and they allow the child to self-regulate as much as possible. They want their child to be independent and kind of make their own decisions, basically. So their nonverbal gestures and facial expressions are passive protest, helplessness, and apathy. So in terms of proxemics, these parents will move away from the child. They will retreat, um, and usually not go so much in their space. So in this article, they did a study on the nonverbal interactions between parents and children. It included 240 interactions between the parents and child. The mother's age ranged from 29 to 45 years old, and the father's age ranged from 31 to 53. And because they grabbed a lot of these families from a preschool, the child's age was around 4.2 years old. And each family, before they started this study, they had to fill out a demographic questionnaire. So a high socioeconomic family had two parents with at least a college education, above average income, above average number of rooms in the house, and residents in at least an upper middle class neighborhood. While the low S socioeconomic families had two parents with no more than a 12th grade education, below average income, and below average number of rooms in the house and residents in a disadvantaged neighborhood. So they observed the mother-child relationship while also focusing on the father-child interactions in the family house. So these people would go over to the family's house and kind of watch the mother and child interact with the mother interact with the child, and then on another day they would see how the father interacts with the child. And all of these interactions were recorded on a video camera to see the nonverbal communication patterns. So for the findings, they found that authoritative nonverbal patterns were displayed more often by high socioeconomic parents. They really emphasized task completion. They wanted their child to be able to play with the toys or do anything like that. And from that, the high SES parents encouraged high conversations and conformity from their children. So this was an open communication family style. While the low SES parents used the authoritarian pattern more often than the high SES parents. So the nonverbal behavior of invasion, they wanted to basically do the task for them, or at least step in and kind of take over, which this is a closed communication family style. It doesn't allow the child to actually play with the toys, and also, which is not also helping the child development. With the low SES fathers, they were more likely authority figures, so they were tougher and more task oriented. So this parenting style would be considered authoritarian. The high SES mothers expressed kind of the same patterns with the low SES fathers, and that could be explained because the mothers have adopted a strong task orientation.
So nonverbal communication at the workplace. Nonverbal communication plays an essential role in the success of employees. At the workplace, it is common for individuals to carefully structure their sentences in order to be perceived professionally. But since it is argued that the majority of communication is nonverbal, it is even more essential that they carefully structure their nonverbal cues in order to be perceived in the way they want to be perceived. Professional image. In the past, it has been believed that people in the workplace are influenced by reason and logic. New research has proven that that is not necessarily the case. People are instead influenced by the non-verbal messages. The way you carry yourself, where you place your hands, the quality of your handshake can all be picked up subconsciously by others. When you enter a room or a business meeting, walk with a strong stride. Have a good posture and keep your shoulders back while displaying a friendly smile on your face. This sends a confident but friendly message. There is a fine line between arrogance and confidence. Be careful not to cross it. Research shows that it takes an average of 3 hours of continuous interaction to develop the same level of rapport that you can get with a single handshake. Ensure you make palm-to-palm contact with the other individual. Have a firm grip and make eye contact. A greeting like this sends several messages, including confidence, professional respect for the individual, and a warm and inviting greeting. Interestingly enough, research has proven that a relaxed posture and open hand gestures signal credibility and honesty. These attributes are essential in any workplace. In a professional setting, it is more important than in any other setting to respect personal space. Stay at least 2 feet away at all times. How you communicate, like how you stand close to someone that's your best friend compared to how you know someone professionally is very different. If you're standing very close and in someone's personal space that you only know professionally, that is going to impact how they interpret everything else that you are sending and all the other messages because they're so caught up in how comfortable they feel. Have you ever heard of the old saying, you look the part, you get the part? A lot is said by how a person presents themselves. In fact, when someone first walks into the room, the first thing others notice is what they're wearing. What someone wears tells a lot about them, including their personality, their culture, their financial status, and how organized they are. If you show up to work dressed sloppy or just with wrinkly clothes, that is going to send negative messages and is going to show that you don't necessarily care and you're not that interested in your job and that it is not one of your priorities. A study was conducted using qualitative interviews to determine how critically ill clients respond to nonverbal communication of healthcare workers. The study found that clients use nonverbal cues to determine if their healthcare workers are concerned for their well-being or if they view them as inconveniences. Clients whose healthcare workers take extra time to be attentive and sensitive have a greater sense of safety and positivity while in the hospital. This same study can be applied to different professions other than healthcare workers, such as lawyers, politicians, retail workers, in order to build rapport. It is crucial that professionals establish eye contact with their patients. Avoidance of eye contact with a client is often interpreted as dishonesty. Avoid looking around the room, but at all costs, never look at the clock. This sends a message that you are not only disinterested, but also in a hurry. Have an open stance, lean toward the client, crossed arms or hands on the hip communicate a closed-off message. Leaning into the client and having arms to the side signal an inviting message. Research shows that this facilitates the client to feel more comfortable in opening up. Prior to the start of the conversation, decrease the interruptions in the room, whether that means turning off the TV, closing your laptop, shutting the door, or silencing your phone. By doing these things, you are conveying to the client that you respect their time and them, and not only that, but you also view your interaction with them to be important and more important than these distractions. Make sure that your facial expressions are not only appropriate to what you are saying, but also an appropriate response to the client's message. As the first slide said, if the nonverbal and verbal messages contradict themselves, the receiver is most likely to believe the nonverbal. So just be extremely conscientious of this and make sure that your facial expressions are parallel to the content. Research shows that these actions will lead to a client relationship that is built on respect and professionalism and will result in positive work outcomes and will also increase job satisfaction.
Hi everybody. As we explained earlier, nonverbal communication includes facial expression, body language, and gesture. As a nurse, I come across patients and family from different culture, origin, and background. Nonverbal communication is very important in my career. I'm originally from France, and we use a lot of hand gesture. The touch is very important to pass the message. At work, Taking care of my resident is my priority. Gesture, once more, facial expression, the tone of the voice, the smile, and even eye contact may or may not be appropriate. Each time I have a new resident, I gather all information about the individual culture, background, and also the gender before I approach the person. For example, with, with my patient, with patients from some part of the world, especially like some part of Africa, eye contact is not appropriate. It's something to avoid. In other part of the world, handshaking is a big no, especially if you're a female and you're talking to an elderly male. To better communicate that word, maintain eye contact to establish contact when speaking. Do not stare at the person. Eye contact may be viewed as a sign of confidence. Facial expression convey emotion. We should avoid grimacing when we talk to somebody, especially a frowning face can be viewed as you're upset, you're hungry, and you just want to get away from the situation, when in fact it's not so. Be considerate to the person's space. Getting too close to somebody, especially with somebody like me, I have a strong accent. So they may not understand what I say, but me being close and using hand gesture, they may think I'm upset and I'm ready to give a point out. But of course, because of the perception they already have during the communication. It's very important to mind your body posture. Avoid crossing your hand on your chest or having your hand in your pocket because it's viewed as an I don't care attitude, and that is a big no at work. You want people to come to you, people to have a conversation with you, but you don't want to make a barrier between the person you're talking to and yourself. Slushing, dangling is also having meaning. It's like you're not interested. What the person is telling you have no benefit and you don't care to know. Swinging your leg during a meeting or hitting at the table with a pen is very wrong. To you, it may not mean anything, but the next person may see it as you're ready to end the meeting, you're ready to go. Whatever is taking place do no longer interest you. So please, let's learn about voice gesture, what facial expression, and better way to communicate with others, especially if you're in a nursing field, because it's very important. Individuals come to you, they're already from different backgrounds, and they're already afraid because of the illness in their body. But not knowing what you're about to tell them, is going to create another barrier, and you will not be able to perform your work, be a comfort, and bring a positivity in their health. Thank you.
Hello, guys. So, nonverbal communication and gender. Gender plays a very big role in nonverbal communication. Nonverbal communication doesn't necessarily have to mean emotion. It can mean a lot of things. Most of the times, it mean gestures, signals, anything that's really tied all together with emotion, not just emotion specifically. They don't specifically have an emotional meaning. Um, a lot of times, people don't really pay attention to the type of gestures that they do, different gestures that they do for different genders. A lot of people don't really know that they're doing it unless someone points it out and asks them, well, why are you doing this for this gender, but you don't do that for another gender? It's oftentimes it can be brought up into workplaces with, hiring new people, and some people might, do different things with males and then do a different type of gesture with a female who's coming in and being interviewed for the same thing. Um, some different type of nonverbal communication, specifically for genders, could be that some mothers might show more varied facial expression to their daughters than their sons. A lot of time, women think that their daughter need them more than their son. They tend to think that their son is, you know, a boy. He needs a father to look up to. Yes, he needs a mother to love him, but a father to look up to get different gestures and stuff from, to different ways to know how to approach a woman or a man or anyone higher up or anyone of age. So um um a lot of women like to tend to coddle their daughters more because they feel that they're a reflection of them. They want them to be just as successful as them, and not go down the wrong path. So they try to teach them early on and do what um, typically what females call what a woman is supposed to do. So oftentimes it's difficult to identify what emotion is being felt. So that's why, like, a lot of times through text messages, um, it can be hard to feel what kind of what emotion the person is sending you through text, unless they're actually sending actual emojis or like a voice call to you. You won't really actually know. So a lot of times people assume, and then sometimes their assumptions are wrong. Like, they can think someone's yelling at them even though that person's not yelling at them. That's just how they type. So it can be a lot of miscommunication through text messages, through, emails, anything of that sort that's not verbal and face to face. People might see a woman smiling and find it, welcoming, and she's just smiling at me. She's being very welcoming. She's being very friendly. So a lot of times people don't tend to think about it much. But if a female sees a man, just looking at them and smiling, just constantly smiling, they're going to start to feel, creeped out or, uncomfortable and weirded out. Kind of like, why is this man looking at me? Like, what's his issue? A lot of times women have their guard up with men. Um, Shaking hands is a common nonverbal communication gesture that is looked at from, separate point of views. A woman can shake a man's hand and, um, hold his hand for quite a while and then, invite him to her office to, have a chat. Maybe they're doing meeting, maybe it's an interview, you never know. And the man might not think twice of that hand hold. But if a man does it, a woman tends to kind of, be standoffish, kind of have her guard up because it's like, okay, why is he holding my hand for this long? Um, what is he thinking? Like, is he trying to do something? You never know. Women never tend to know what a man is thinking because of everything that's going on in the world. So it's kind of hard with genders and the nonverbal communication. It kind of gets mixed up and misconstrued, and then people tend to, think that someone's thinking this and then the person's thinking something completely different. So there's a lot of miscommunication with this between the two genders. Um, yeah, so I say a lot of people just need to, be careful with what they say and how they say things, and to make sure that they let the person know the way that they're coming off, their emotion that they're trying to express. So that is all that I have for you guys. Thank you.
So, in conclusion, on how to better communicate using nonverbal communication, your nonverbal skills vary very differently depending on whether you're communicating with your family, people at your workplace, or people from different genders or from different cultures. So it is important to always be cognizant of that and to make sure that your nonverbal and verbal messages are always parallel. That's should hopefully is the biggest takeaway from this presentation. With families, there are different parenting styles: authoritative, authoritarian, and permissive. There's no wrong or right way to parent. It's just important that your nonverbal communication skills are parallel to the values that you are trying to instill in your child. And at the workplace, it is important that you display yourself very professionally and respectfully among different cultures. It is important that you are culturally aware and culturally competent, and that your nonverbal messages are respectful and will not make another person feel uncomfortable or offended. And with genders, same goes for that. Always be aware of the different stigmas and the different ways of different genders. Male and females are very different, and to just be aware and to be very respectful. And if you're ever not sure on what someone is trying to say with their nonverbal messages, it's never hurts to clarify. And these are our references. Thank you.